Dr. Swartz has been thinking very hard about the mental health of the most avid users of social media, adolescents and young adults, for a long time. So I'm sure that today's, what should be an extremely interesting Grand Rounds, will be very, very well informed.
Let everyone have a minute to come in. So thank you, Dr. Zajac and Dr. Tran, for finding the perfect patient to start. Essentially, my whole talk has just been presented in this interview. So let me start with a definition of social media. Most of us know these are the apps and the websites where people are able to have community-based education, and there's an element of it, of course, which is public, as we were hearing about. It's not texting your brother. You know, it's this element where there's public and other people are commenting. Some things are, one might say, more boring, like LinkedIn, but that's social media of a sort. But most people are thinking about Instagram, TikTok, Facebook, etc. And I'll talk a little bit more about those. So today, I hope that we're going to discuss the impact of social media on youth, talk about those more vulnerable to social media messaging, of course, the people we're working with every day, the current evidence for social media's relationship with mental health issues, and finally discuss best practices. What is the advice we should be using ourselves and also talking with young people about? So I would like to share with you my introduction to Facebook. So this phenomenon that is Facebook started at the Harvard campus in 2004, and as a Princetonian, then you should know it was not going to be good. Let's just be honest, right? Suspect. My introduction to Facebook came in 2007. I looked this up. I had a lovely young woman in my office, a high school student, and she was in tears talking about a party she hadn't been invited to. And I said, how do you know you weren't invited to this party? Thinking, I never knew what I wasn't invited to. I was just, whatever. And she said, it's on Facebook. And I said, what's Facebook? She said, well, if I can get on your computer, I can show you. So we sat down, I got her a browser, and she linked, and then there I saw all the pictures of her friends at a party she hadn't been invited to. And my immediate reaction was, this is a disaster. Recently, I was talking about this subject with Elizabeth Philip McFarland, and she reminded me of the perfect Theodore Roosevelt quote for all of social media. The comparison is the thief of joy. And that's what we're setting up for. Now, this is not a new problem. We've all seen this painting by Norman Rockwell of the perfect Thanksgiving that has never existed. No one has ever had this Thanksgiving dinner. This is the time of year I start reminding people that he moved to Vermont so that his first wife, who was severely psychiatrically ill, could get better inpatient care. He never had this Thanksgiving. This Thanksgiving does not exist. But what we have now is Facebook. And so based on Facebook, every one of you was at a family reunion or at a wedding this past weekend. I hope you enjoyed them. And this curating, really interestingly, there was a survey of about 900 youth where they said, what is your advice to others about social media? They asked them to give advice about what to do. And their number one piece of advice was, remember that things on social media are not real. You're looking at people's highlights, not real life. They also said, don't forget about real life. It's sort of sad that they think they have to remind their peers of that. And that you need to limit the time you're spending on social media, which we heard that good advice this morning. You have to just think about all that. But what is the issue with social media? Where is it? So every year, Hootsuite, that's really a thing, Hootsuite, and We Are Social does a global survey to look at the numbers related to social media. And what they found in their January 2022 report, that's their most recent, was that with the population of almost 8 billion, that we had over 4 billion, 4.62 billion social media users. So when you think about what does that actually mean for population growth, because they do it year to year. So comparing 2021 to 2022, there was a 1% growth in the population roughly, and there was a 10% growth in social media users. So this is exploding. Now, if we look at this whole population, and you say, all right, well, what percent is that? I saw the numbers, but what percent is it? we find that it's about 60% that are using social media, but that's total population. That includes infants, who I hope are not on social media yet. So if you look at those 13 and over, 75% are using social media. So we just have to assume this is happening, and then what are we going to do about it? So if we think about the popular social media platforms, and I'm proud to say I am on really none of these. I've gone to our residency's Instagram page, but other than that, I just won't. But I'm not like, most people have a different view of this. So Facebook, the big F, that's for older people. Young people cannot be bothered with Facebook. They're on TikTok and Instagram. Reddit has replaced Dr. Google as the place where people are getting a lot of medical information that perhaps is not vetted, because there's just discussion. That green phone is WhatsApp for those older individuals in the audience. That's used by all groups because you can do international communication and group chats. And then this little ghost, the little ghost is Snapchat. Now, I might argue that Snapchat is essentially cyberbullying set up on an app, because you send images, messages, etc., and then they go away. If you actually take a picture of it, a screenshot, to show someone what's going on, the person who sent you the message is informed that you took a screenshot. I was talking recently with one of our graduates, Candace Esmeralda, about this, and she's doing child fellowship, and she said, wow, I'm hearing from these kids that they're just getting bombarded, and you can't escape it, right? It's 24/7. And globally, the average time spent is 2.5 hours a day. If you look among different age groups, you can see that those using social media the most are, not surprisingly, the youngest age group. These are the age ranges that are in this particular survey. So it's about 3 hours for those that are 16 to 24, and those of us who are in the oldest group, it's still over an hour. There's a pattern for every age group where women are on for longer, for about a half an hour a day longer. So this is really concerning, and I think we should presume that the range of time is just going to wash through as the cohort ages. Maybe not, maybe you get busier or something else, but we will see. So what does this mean for our patients, the people we're working with? As psychiatrists, how do we have to think about this? Those of you who are parents, you have to think about it differently, but I'd like to take a minute to talk about how we should think about it as psychiatrists. So I think a lot about Schaffer's model of suicide prevention. This really informed how we talk to young people with ADAP. So he has a very helpful model, which is getting to the point that if you are ill, and you have an active disorder, then you have cognitive distortions that are different than if you're well. I know that's basic, but it's important, because when there's a stress event, maybe an unpleasant post or something you've seen, that's going to hit you differently than if you're well. And that stress event can actually cause an acute mood change, which might lead to someone who before wasn't having suicidal thoughts having suicidal thoughts. It's not the breakup per se. I may have heard this in high schools for 25 years. It's not the breakup or the bad grade or the whatever. It's that something happened to someone who wasn't well. So that relates to all kinds of things in the media. For example, this horrible show. John Campo and his colleague, Dr. Bridge, at Ohio State, before he came to join us, did an evaluation of what was the impact of 13 Reasons Why. And they were looking to see, was there an association between the release of 13 Reasons Why and suicide rates in 10 to 17-year-olds in the US. And the data is pretty chilling. So if you look, the blue dots are actual death by suicide rates. And then the orange triangles you see at the end are what would be predicted. That orange line is the best fit line. What you can see, if I can get this to work, right in that blue bar, there's a much higher than expected rate when the trailer came out, and then right after it was released, you see the highest suicide rate during this time frame. Now, just a reminder, when it was first released, there were no public service announcements, there were no resources, now there's a message, I understand, that I'm too cheap to have Netflix, so someone told me, that there's now a message that says, if you're feeling suicidal, here are resources, here's the National Suicide Hotline, but that wasn't there when it first came out. And I heard this in high schools and doing ADAP trainings around the country when it came out, that there were young people making suicide pacts because it influenced how they thought about it. So in general, you can already tell my view of, is social media harmful? The APA does a monthly poll, and in January 2020, they surveyed 2,200 adults in a nationally representative survey, and they asked the question, in your opinion, does social media do more harm than good or more good than harm for your mental health? As you can see, the largest group is neutral, 45%. 34% said more harm than good, and 20% said more good than harm. Interestingly, in other data from this survey, it showed that among those who were not using social media, which includes people that took themselves off or people that chose to never use it, 63% said it did more harm than good. The group that was most likely to say it did more good than harm were women between 18 and 34, and half of them had that response. So every year, the C.S. Mott Children's Hospital at the University of Michigan does a poll of parents, and they ask them to rate topics as to whether they think it's a big problem for children, somewhat of a problem, or not a problem. And you can see their top 10 here from 2023. The first 3 have everything to do with social media and internet use. I would argue that the rest of them relate to that, particularly depression, suicide, bullying, stress, and anxiety. But parents know this is something they need to worry about. They're hearing it from their kids, and I think we know from talking with our patients that this is obviously an important topic. Now, not unrelated to this is social isolation and loneliness. And the Surgeon General recently had a call to action to address this. Needless to say, the COVID pandemic, I think, really underscored the concerns we have about this. So in this very nice summary report, they talk about the vital components of social connection. One is the structure. Who's in your house? Who do you see? I would argue here, who do you have lunch with at work? Who do you work with in a close proximity? The function. So what's the role? Is that someone who's a mentor? Is that someone who provides support? What role do they have in their life, and how meaningful is that? And then finally, the quality. What is the nature of this relationship? Is it one that overall makes you positive, or is it one that brings a lot of negative feelings? I would argue that actual people you can have lunch with are going to be better in all these realms than someone you only know on Facebook. And there's a whole group of people that are very isolated. Now, if you're tremendously isolated, it might be good, as we heard today. If you're in an isolated minority group, you might be able to reach out and get to know people because the people on your street aren't going to be a part of your group. But in general, we want people to be working on these relationships that involve actual social interaction. And the same authors that were the lead of this view of social connections have estimated that lacking social connections is as dangerous for your health, more dangerous actually, than smoking 15 cigarettes a day. Other work they did in a number of studies with a long follow-up period suggested that social connection increased the odds of survival by 50%. So this is not good. So in a study at the University of Pennsylvania, they did what they all did. They got undergraduates in their psychology class to be in a study, which is great. Many of us did this as undergrads. And they said, we're going to have 2 groups, and we're going to have a true experimental group. You're going to get randomized, and you're either going to keep doing social media, however you do it, or we're going to ask you to limit your Instagram, Facebook, and Snapchat accounts. And then we will see over time what happens. And they had to focus on a number of different outcomes. I'm going to focus on loneliness and depression. So first, they actually did it. If you look in the experimental group, they are below 200 minutes in a week. So you figure 7 days, 30 minutes, they could be at 210. And in comments in the paper, you can see they had comments from participants that included things like, once I was using it less, I realized I didn't miss it. Sort of making a new habit that they did that differently. So they were able to do that and sustain it. So then they looked at loneliness, and they used the UCLA loneliness scale. And so this is looking at perceived loneliness, and it includes questions like, no one really knows me, my interests and ideas are not shared by those around me, I feel in tune with the people around me. So this is a well-validated scale developed at UCLA. And you can see that those in the experimental group limiting time on social media had an improvement. But what, of course, was more interesting to me was depression. They're at the University of Pennsylvania, so of course they used the Beck Depression Inventory. And they stratified by baseline low versus high depression. So they had one group of low depression rating, so under the cutoff of 14, where you can see they averaged 5, which is not depressed. And then the group that had higher ratings. And it's what I think we would all expect. For those who are not depressed, limiting doesn't do a whole lot one way or the other. Because that's someone that can say, oh, that's ridiculous, or I'm not paying attention to that, or this is boring me, I'm stopping. Those who are depressed, limiting social media use led to a significant improvement in their depressive scale, the Beck Depressive Inventory. So, all right, this is sort of what we think. If you are going through significant symptoms, depression, anxiety, et cetera, and they also found similar improvements in scales related to anxiety and a validated scale on the fear of missing out. We talk about that concept, but they have validated a scale looking at that, and that was less. So comparison is the thief of joy. Next, I'd like to talk a little bit about cyberbullying. And we heard that alluded to, where you hear hate. So the Pew Charitable Trust did a study of 743 teens, ages 13 to 17. And they did this study in March to April 2018. Interestingly, also in the report, they said that 45% of these teens said they were almost constantly on social media, as we heard this morning. You know, I was on it all the time. As you can see, 59% of teens reported that they had experienced some form of cyberbullying. And those include things like being called names, having false rumors spread about you, getting explicit images you did not want, having someone trying to track down where you are, which is quite scary to think about with young people, physical threats, and having explicit images of you shared with others without your permission. They had gender data, so they were able to see that young women were more likely to have these rumors spread about them, to receive explicit images, and to have someone trying to track down where they are. So all very concerning. There was a really well-done meta-analysis that put together data from 42 studies with over 266,000 participants during an 11-year range. And they were able, from this big group of studies, to do two sub-analyses. One, where they were comparing traditional bullying in person, where you're seeing the person, you know, presumably at school, with cyberbullying. And then they were looking at the odds ratios of either of those exposures or both in a subset where they had information, did you have both? Were they likely to produce depression, self-harm, suicide attempts, and suicidal ideation? They couldn't truly do causality because they were cross-sectional studies, but they're looking for these associations. In their study, they found that it was 24% of the participants that had been bullied in person, traditionally, and about 11% that have been cyberbullied. One thing to think about cyberbullying before we look at the results, it is more public, it is around the clock, and it's anonymous. So you can't get a break. If anyone ever had the experience of someone annoying, bugging them at school because they were a nerd, we might have that in this room, right? You could go home. And maybe at home you'd be celebrated for being a nerd, just saying. You know, that versus it's constant, it's ongoing, you don't know where it's coming from, and it could happen at any time. So I think that changes things. Interestingly, only a third of traditional bullying victims also had cyberbullying in what they reported, but among those who were cyberbullied, 2/3 of them also had traditional bullying. So it is sort of that sense of constant. It's constant for whatever reason. So these studies included youth that were between 8 and 20, and it was studies that looked at bullying by peers, so not adults, etc. So these are fairly chilling results. So you're looking at the odds ratios of having had traditional bullying, which are the blue squares, versus cyberbullying in red, to see what the odds were that someone also had depressive symptoms, self-harm, suicide attempts, or suicidal ideation. And there is a very rich literature linking cyberbullying with suicide attempts and suicidal ideation. So these are odds ratios around 3, which in psychiatry are substantial. You know, the odds ratio, I looked this up. The odds ratio, if you do studies of smoking and cigarettes, if you do ever smoking, never smoking, now obviously that doesn't include pack years, that's 10 to 15. So with our multifactorial conditions, 3 is not trivial. And then if you look at the studies where they looked at both, that you either had cyberbullying, traditional bullying only, or both, you can see that those odds are now in the 6-7 odds ratio range, which are really significant. So this is a real problem, and it's something that I think we need to be more specifically addressing with our patients. Now, there was a study done in the Department of Mental Health at our School of Public Health, done by Kiara Ream during her PhD and led by Dr. Moshabai and other members of our department, where they did a really elegant cohort study looking at 6,500 young people where they had data on them for 3 years in a row. This was part of the Population Assessment of Tobacco and Health Study, or PATH. And they were looking at their primary exposure being time on social media. But as I'll show you, because they had 3 time points, they could get baseline data and then assess social media and then see at follow-up, did they have internalizing and externalizing conditions. In large epidemiologic studies, it's not unusual because you can't really do a diagnosis. So they'll do scales to look at internalizing depression, anxiety, and externalizing often ADD, oppositional defiant disorder, you know, sort of those categories. So if you look, they were looking at sex, race, age, BMI, parental education level, lifetime alcohol use, lifetime marijuana use, and lifetime internalizing and externalizing problems. So they had that at baseline. At wave 2, they got time spent on social media, and wave 3, they were assessing for these psychological problems. No social media use was the baseline. So that was the comparator. So a reference of 1. So remember with odds ratios, anything above 1 is a risk. Anything below 1 would be protective. So looking here, where the scale is starting at 1, you'll see that there is a dose response to amount of social media use. Now the green bars are less than 30 minutes a day, and that was 30% of the group. The gold bars are 30 minutes to 3 hours. I'm sorry, yes, 30 minutes to 3 hours, and that was 31% of the group. 3 to 6 hours was 12%, and over 6 hours, which I thought had to be 3 people, was actually 8.4% of the sample. So these 2 high groups, where you're 3 hours and above, are 20% of the sample. And you can see what I think we would predict, which is with internalizing problems, depression and anxiety, there's a clear dose response. And it becomes significant once you get to 3 hours or more. With externalizing problems, you don't see that same relationship. And then when you get to the combination where they have both, it's even stronger. They also looked at the percent who had mental health problems, and it follows the same pattern. For internalizing problems, it goes up with exposure. For externalizing only, it's not a clear relationship, and the combination, it's quite high, with 20% of those that have both internalizing and externalizing problems being those using 6 hours or more of social media. All right, so exposure to it is not great. What about what you're exposed to? So in a different study, they followed 658 high school students. Now, this is part of a bigger study they've been doing at Brown, where they had recruited students from 6 different Rhode Island middle schools, and they've been following them for years. So they took a subset once they were in high school. So these are now high school students, and they had 2 time points where they saw them. At the first, they got information about whether their friends posted about alcohol-related content on the social networking sites, so Instagram, Facebook, TikTok, etc. And then ask about their alcohol-related injunctive norms. Now, I love that phrase. It's so psychological, I say to my colleagues here. And that means, what are the norms that people feel they have to follow based on what they think others expect of them? So think peer pressure. And what are the expectations? What is my peer group's expectations? And they got information about other risk factors for alcohol use. At time 2, they wanted to see, have you initiated? Because again, because it's time 1, it's a true cohort, they eliminated people already drinking. So they wanted to see, have you started to drink? Have you become drunk for the first time? And have you had heavy episodic drinking, where you've had at least 3 drinks on multiple occasions? And to see if seeing your friends with beers in their hand on social media had any influence. It will surprise no one that exposure to your friends' alcohol use was predictive of initiating drinking and having heavy alcohol use. They controlled for multiple things, including your peer orientation, demographics, and parental monitoring. And, the thought is, yes, if you think alcohol is important to your friends and you're in that friend group, not surprising, you're more likely to drink. One of our graduates, Caitlin Costello, Phipps class of 2012, was one of 2 authors that put forward an editorial associated with this study, saying, what are the responsibilities of mental health practitioners to address this? The first thing she said, which I think is really important for all of us, is that we need to start incorporating inquiries about social media use and online behaviors in our assessments. They just should be part of every behavior we're asking about. It's a common behavior among youth. We should ask about it for everyone, but particularly people that are younger. We need teens to talk about substance use and exposure to substance use on social media, just not, are you going to parties? Are you being pressured to do this? And very importantly, as we are meeting with their families, as we should be, especially with younger people, we need to ask about what the social media use is in the home. Do they have rules? Is it regulated? Or is it whatever you want to do? And encourage parents to have rules about this. A lot of times in family therapy, we are helping people set up rules. So this might be one that we're doing in the future. Now, I have been pretty unrelentingly negative about social media to this point. So I'd like to just end with a few more positive things. What are the benefits? We heard about it today. You stay connected with people, you meet people, you find community. We heard that this morning. You're able to share your creative expressions. There was a very nice study of 1,200 youth online where they looked at young men, young women, and transgender non-binary youth. And they found that in that group, interestingly, those with the highest social media use had the lowest self-reported emotional problems. With the speculation we heard today, I found my people. So perhaps if you're in a situation where you do not have a community nearby, this could help. They also found that that group was more carefully curating their feeds, eliminating certain things and only going on certain sites. Now, ACAP, the American Academy of Child and Adolescent Psychiatry, who said those positive things, also said in their same position paper that we have to worry about, are young people being exposed to harmful comment? Are they being exposed to dangerous people? Obviously, cyberbullying, as we've talked about. And then these practical things. Don't overshare. Realize that people are trying to sell you things. The minute you buy something, suddenly all the ads on everything you go on, you'll notice this, are about the thing you just bought. It's ridiculous. And that there are privacy concerns where you want to think about what you do and you want to worry about your identity being hacked. And most importantly, you don't want it to get in the way of going outside, doing something else, getting enough sleep. So what did they say parents need to do? You need to be on the accounts. You have to say, we're happy for you to have this phone, but I need to have access. There has to be times with no screen time, like no screens at dinner, maybe no screens in the bedroom. Here's the thing, parents, if you don't put down your phones, no one will take you seriously. So the kids have to put them down, and you have to put them down too. You can put on privacy settings, you can do, as we heard, tell people don't share this information that would be bad and where you're located, but also you can limit which apps a young person can get onto based on their age, but you can also set up timers, help them set up timers so they know it's too much. So I'd like to end just by going over some really thoughtful recommendations that the American Psychological Association put out in a recent health advisory on social media use in adolescents that came out in May of 2023. I have two parts. The first are general things, and then the second are things that relate to our patients more directly. So use social media for the good things. Connect with community, be connected to your friends, find your high school friends. That all sounds good. Make sure you have use that's appropriate for age. Adults should be monitoring and coaching and giving guidance to young people. And don't let it interfere with the things you're doing. And they recommend, and I agree, that we need to have social media literacy training. So that's the advertisers are after you and don't put this information, and what the young people said in their survey, which is remember social media is not real. Just really teaching all of that explicitly. But what relates to our patients? Trying to minimize exposure to things that are maladaptive. We've heard from Dr. Guarda before in Grand Rounds about the sites that can tell you how to be more active in your eating disorder. There are reports I read about young people posting pictures of their cutting so that they can compare. I mean, these are the kinds of things that we obviously do not want vulnerable people doing. Minimizing your exposure to cyber hate, so getting off that sites and helping people talk about it and getting strategies for that. Screening for problematic use, which could be that it's so much time or it's so upsetting that you're not able to function in the way you would like to. And then trying to not use it for comparisons and talking with people about that. I have a number of patients that have very different experiences on social media when they're depressed versus not, as Dr. Potash was asking our patient this morning. So thinking about that, this is not the time for you to be scanning things to learn about your former partners and their current lives. So to conclude, social media does have potential to provide connections, especially for those maybe in minority communities that are not connected. It's also very entertaining if you want to watch videos of baby goats in pajamas, which I recommend to you. It has the potential for significant negative consequences for mental health, particularly among vulnerable individuals. There are benefits of limiting time, which we can see from the data, and also protecting youth, obviously, from cyberbullying. And for those with active illnesses and distorted thinking, I think social media is harmful. And I think we have to be more direct in talking with our patients about that specifically. So we need to more routinely ask about social media use and incorporate that in our care of patients. And with that, I will thank you.
Thank you, Dr. Swartz. Great talk. A lot of really interesting data. Interesting to see what those studies have shown. And you made a lot of terrific points. I think the issue of systematically asking patients about social media use is a really good one. I suppose we could think about whether we need to incorporate that in a formal way into our assessments and our training programs. Let me ask you about a point you and I have talked about a little bit, because our patient today was from the inpatient unit. What about the use of social media while people are on our inpatient units?
Well, I'd love for everyone to have their timer set to limit it. I do like that patients can FaceTime with their families. I like that those who are missing their kids can see their children. And so I think it's tricky. In general, if I could say, we'll just ban, like we could set up a force field so Facebook, Instagram, and TikTok don't work on my floor, I'm there. Because you could still have all those other connections in more meaningful ways. But I think it's tricky because we're also then limiting people for doing things that are helpful, especially when they have a lot of downtime and they're feeling really isolated. So I think we should be talking to people about it And I think we should try to get people to engage in the therapeutic activities so they're doing that instead. But as much as I would like to, I think it's going to be a problem to take everybody's phones.
Okay, thanks. Dr. Redgrave.
I'll just make a follow-up comment there that one of the pieces of role induction that I do for particularly for young people when they're being admitted to the eating disorder service is to talk about phones. Interestingly, one of the few things that positively distinguishes our program from a consumer point of view is that you can have a phone on our unit, which many programs do not allow. And so what that means is it's also a potential contingency management strategy. And I say this, you can have your phone, but it's a privilege, not a right. And there are circumstances under which we might take it if you are using it inappropriately or if you're not doing other things that are important. And I think it's nice to have that conversation on day one so that you're not sort of ambushing them with trying to take the phone without having to have it prior to session.
Do you want to comment?
Yes, no, I completely agree with you, Dr. Redgrave. Just the contingency, can we use this phone use in a therapeutic way? We can. And I also think there are times we need to intervene, and someone perhaps with severe mania, should not have their phones or the computers because of, the trouble they might get up to for themselves, either spending money or making posts or things like that. So I think we have to be aware of what's going on, and the best way we usually hear about it is from their families. So routinely asking families about what are you seeing that they're posting and what is any of that concerning.
Mm-hmm. Dr. Bienvenu.
Thanks so much for this. I'm going to say to my patients, we just had grand rounds on it. I've done that plenty of times. As I was thinking, I don't need to derail us from talking about adolescents and young adults, but I was thinking media use probably be limited. People across a wide variety of age groups, and I was just curious what you thought.
So should we be talking to people about limiting media use? Absolutely. We should be. What was the most touching part of the interview this morning is when this young person said, well, I put these limits on, and then sometimes I went out for a walk. What are people doing? Are you interacting with people? Thankfully, we're at a different phase of the pandemic where you could go to dinner, invite someone over. It'll make a difference. And so I think we do need to talk with people about what they're doing. I think about everything being good for your mood or bad for your mood. Binge watching Netflix for 6 hours is not good for your mood. A walk on a gorgeous day like Saturday is great for your mood. And so I think we need to talk about that. And I think different ages probably use different media. It's social media more for younger people, but it could be other kinds of media for adults that we're taking care of. And the whole social isolation piece. It's a majority of those who are over 60 that talk about this, and that's the group we really need to target. Not that it doesn't affect everyone, but our older patients could be very isolated and got more isolated during COVID, and we have to work with them to reestablish habits. 3 years changes your habits.
Mm-hmm. Dr. Sedlak.
Thanks for the overview, Karen. About 3 years ago, I remember a barrage of reports about rapid onset tic disorder and Tourette's-like symptoms in the context of social media use. Have you seen much systematic examination of non-mood disorder symptoms?
Yes, so can TikTok induce things? I think we've known for a long time that media can induce fads of all kinds of things. So, I think that, again, the people most vulnerable to that are young people who are vulnerable. So they might be our patients, and so we have to think about it and then ask, well, where did you first get the idea that this was going on, et cetera? Because, you're looking for an answer to explain why you feel so awful.
All right. Dr. Nestat.
Misinformation is usually what people talk about social media in the larger sphere. But just like Tom's saying, it seems like the way mental health information gets across the social media is particularly troubling, especially things like social identity, judgment disorder, or personality disorder. In youth, I've talked to child psychiatrists, they see this all the time. Are we starting to see that in adults too, the sort of contagious symptoms because of how they're presented? Is that adult?
I don't know data about is there a contagion effect. my gut is yes. I certainly have people that come in and talk about it. It used to be that people would come in and there had been a movie about something or something had been on television, but now it's ubiquitous. It's all over the place. And so, I think the way we deal with that is the way we deal with everything. We get a really careful history and figure out what's going on. But I do think it's a marker for distress, and we shouldn't forget that. It's the most distressed that are vulnerable to all of these things. I was a resident during the craze of multiple personality disorders. And to me, Dr. Bamman and I were doing this together, and to me, what I remember from that era is that they were very vulnerable people that were highly suggestible that got caught up in that. So again, you're dealing with people that are highly suggestible, very vulnerable, and then think, okay, what is really going on? That they've decided that this is an okay way to present their distress. But I think everyone's vulnerable.
One last question, Dr. Margolis.
More of a comment that there's also other kinds of phenomena that I think induce the senior patients where their hallucinations and delusions only came out while they were focusing on their social media to the point where I almost thought about coining a term of Facebook psychosis. Like, worries, there are other elements as well that elicit symptoms from these kind of experiences.
I agree with your comment, Dr. Margolis. There was no question. It was just a comment. I think, look, I think that when you have people consuming information, it's going to hit them differently. I'll go back to, if you're not depressed, it doesn't matter so much. But also, if you're not depressed, you're probably using social media less. You're going to be less vulnerable to whatever you're going to see on Facebook or somewhere else, right? You're also more vulnerable to what gets said to you in the grocery store if you're really sick. So I don't think it's only technology that's doing this. I think it's, coming out with what was on the news before and things like that. So.
Thank you, Dr. Swartz.
You're welcome.
Thanks, everybody, for coming.